All right, welcome back. Well, June is Men's Health Month, and most people think about, prostate cancer and screening as it is the most common cancer that affects men. But awareness about men's health is so much more than that. Men are at risk for a variety of conditions, and that includes cancer. So today we welcome Dr. Andrew Zaginer, a urologic oncologist from Mayo Clinic, to talk about men's health and what cancer men are most at risk for. Thank you so much for being here. We appreciate it.
Good morning. Happy Father's Day. Thanks for having me on.
Yes, happy Father's Day indeed. Well, let's start out with a simple question. What do you recommend for most men regarding their health? What do men need to know?
Yeah, I think the most important thing, honestly, and the easiest thing is just to establish care with a primary care physician. They're vital to ensure that you're not developing high blood pressure, high cholesterol, diabetes. Obviously, they can encourage healthy eating habits, which can be difficult to follow sometimes. And then staying up to date on any recommended vaccinations, and of course, age-appropriate cancer screenings are always important. And I know, most men don't like to go to the doctor. Even as a physician myself, I often make excuses not to go. But it's really important to at least do the basics once a year and just establish care.
That's so important. And are there certain symptoms that men should be on the lookout for that might prompt them to reach out to a physician?
Yeah, of course. Besides the basics of any new lumps or bumps, abnormal bruising, unexpected weight loss, symptoms that I often see as a urologist are blood in the urine, either visible or microscopic blood picked up on urine testing by primary care physicians. Things like urinary difficulties, like urinary urgency, frequency, painful urination, or slow stream. And all these things can be a symptom of an underlying issue or potentially even a cancer. Another thing that often patients see primary care doctors for, or even urologists for, is erectile dysfunction. And actually, some studies have shown that erectile dysfunction can be an early warning sign of current or future heart problems. So it's obviously important. And I think it just emphasizes the importance of establishing care with your primary care doctor to hopefully help prevent any future problems.
And as we celebrate Father's Day, I want to talk about testicular cancer. What type of treatment is involved in testicular cancer? And is it something that may affect fertility?
Yeah, it's a great question. It's a very common question for men when they're initially diagnosed, obviously. Usually the first step in both the diagnosis and treatment of testicular cancer is the removal of the actual testicle itself. And for most patients, this surgery is curative, and simple monitoring with blood tests and CT scans are often all that's needed. However, if the cancer is caught later on or it spreads, we often utilize chemotherapy or radiation treatment to achieve a cure. But for most patients, overwhelmingly, they're cured of testicular cancer, and most patients don't die from testicular cancer. Now, obviously, the removal of the testicle itself makes a lot of men worry about how it's going to affect their testosterone levels. And most men actually can have a normal testosterone level with just one testicle. And even if the testosterone is low, we can easily replace it to a normal level, so it doesn't have a huge impact on their quality of life. From a fertility standpoint, both testicular cancer itself and our treatments can impact fertility. So we typically do encourage patients to consider sperm banking prior to any sort of treatment if they do desire children in the future. Often this is just a backup plan, as most patients can actually remain fertile with just one testicle as long as they don't have any additional treatments with chemotherapy or radiation.
And lastly, let's also talk again about testicular and prostate cancer. What's the takeaway regarding screening and awareness? When really should they come and see somebody like you?
Yeah, it's a great question. First, prostate cancer is extremely common. It's the most commonly diagnosed cancer and the second leading cause of cancer death in men in the United States. On average, 1 in 8 men develop prostate cancer, and the average age is about 65 years old. Now, there is some screening regarding or controversy regarding screening, but after appropriate counseling, we usually begin screening for prostate cancer with a simple blood test and exam around 45 to 50 years old. For men with a strong family history of prostate cancer or other high-risk features, we often start as young as 40. For testicular cancer, it certainly can occur in older men, but it's most common among young men, usually late teens to early 30s. So typically these patients aren't thinking about cancer. The most common symptom is either a painless mass or a painless lump in the testicle. Some patients do experience swelling, discomfort, or pain that prompts the initial visit, but typically it's just picked up on self-exam. And that's something I really want to stress, the importance of routine self-exams for young men. It's simple. It's something you can do in the shower once a month. and it could potentially save your life because testicular cancer is very curable if it's detected early. So I think overall the most important takeaways for the men out there is just to do the simple things to establish care with a primary care physician, pay attention to your body and any symptoms you develop, and then just really don't be afraid of these screening protocols for cancer, because if we can detect it early, we can usually achieve cure without compromising your quality of life. And for the spouses and family watching, I guess just remain persistent. It's often the encouragement from you guys that gets the guys in the door. So we really appreciate it.
Thank you so much, Doctor. We appreciate your time as always, and have a great day.
Thank you, too.